Hello, Dr. Yong-Soo Choi.
Hello, Dr. Sang-ho Lee.
I noticed quite a few patients checking in and waiting today. What kind of conditions are most of them here for?
Patients come in for various reasons, but recently, we've been seeing a lot of people suffering from spinal stenosis.
Would you say the main reason we're seeing so many spinal stenosis cases is because Wooridul Spine Hospital developed a treatment method that can even help patients over the age of 72?
Yes, that's exactly right. These days, the average age of our patients has increased a lot. For women, it's close to 86, and for men, it's over 82. As the population ages, more people are developing age-related conditions. In the past, older patients often couldn't receive treatment due to their age. But now, even elderly patients can safely receive treatment.
So, Dr. Choi, could you briefly explain the treatment options for spinal stenosis, from non-surgical methods to surgical options when necessary?
There are many ways to treat spinal stenosis, depending on the severity. We start with conservative options like physical therapy, exercise therapy, manual therapy, and injections. We also offer various procedures, such as percutaneous epidural neuroplasty, which is a well-known method. If needed, we proceed with surgery, which can range from minimally invasive procedures to more extensive surgeries. But it's not a one-size-fits-all approach. The right treatment depends on each patient's condition, and it's important to find the best method for each individual. When I see patients suffering from stenosis, I just want to help them find relief as quickly as possible.
The main cause of spinal stenosis is thickened ligaments pressing on the nerves. There are various ways to treat that, right? What treatment do you usually prefer?
When I treat patients with spinal stenosis, I use a variety of approaches. As you said, the condition is caused by thickened ligaments compressing the spinal nerves, as if they were being strangled. So the key is to treat the root cause. If the nerves are being squeezed, we have to relieve that pressure so they can function again. If the compression is mild, we can try injections or neuroplasty to reduce the pain. But if the condition worsens and starts causing nerve damage, the best and most effective treatment is to remove the thickened ligament that's compressing the nerves. That's what ligament reconstruction surgery is for. The great thing is that it only requires a small incision. There's no need for a blood transfusion, and most importantly, we don't touch the bones. This means patients can move freely after surgery, with no long-term limitations. That's why it's also safe for elderly patients.
That was a very clear explanation. To add a bit of medical terminology, spinal stenosis can also be caused by spondylolisthesis, when the vertebra slips forward or backward. So, spinal instability often comes with stenosis. If it were just nerve compression, we could fix it with an endoscope or microscope, but we also have to stabilize the spine. So, in a way, we're trying to catch two birds with one stone. Wouldn't you say ligament reconstruction surgery does exactly that?
Yes, I agree 100%.
Thank you so much for your honest and informative explanation about spinal stenosis today. I'm sure it will be very helpful to many patients.
Thank you, Dr. Lee. I learned a lot from you as well. I hope everyone watching this video finds useful information and seeks proper treatment instead of living in pain.
Thank you.